Oh, this is juicy. Buck responded to my comment. A lot of this is good information, and I appreciate you using your platform to educate, but you should not be pressuring folks to get unnecessary medical procedures. The idea that trans men need hysterectomies to maintain their health is outdated and not evidence-based. True, past me of 9 months ago. Man, I've been mad about this for at least 9 months. That's a long time to be mad. Alright, so Buck Angel said, and this is, I'm getting passive-aggressive vibe already. Thank you, but how did I pressure? I used my own actually story for people to hear so they can make an informed choice. So thank you for your opinion, as that's all it is. Mine is actually fact-based. Thank you, but how did I pressure? You made a fucking website, dude. You made a fucking PDF that you tell people to print off and take to their doctor that says that they have to get a hysterectomy if they're on testosterone. Are you fucking kidding me? Thank you, but how did I pressure? Jesus fucking Christ, I hate this guy. Hello, everybody. Today, we're gonna be talking about Buck Angel's most popular YouTube video, which is called Trans Man Vaginal Atrophy. Well, it's called Tranpa, because he's a grandpa who's trans. Get it? Because he's old and he's trans. First thing you might be asking is, hey, Buck Angel, isn't that guy a piece of shit? He is, in fact, a piece of shit. And I gotta say, he was especially irresponsible with this video. You know, on one hand, I could praise him for talking about atrophy, because it is a really important issue. He mentions it in this video that it's not talked about enough, and doctors aren't educated about atrophy that transmasculine people on testosterone experience. That is a problem. Totally agree with him. But there's a little bit of a problem called fear-mongering against minorities, especially trans people who have medical differences from cis people. And the transphobes love using irreversibility in like certain medical procedures as something to be scared of. And actually, when it comes to atrophy is reversible, treatable. I treated my atrophy, and I'm feeling fine. I'm feeling fresh down there in my underpants. In case you were wondering. But yeah, let's just go ahead and get into this and make fun of this guy and correct some mistakes that he made along the way. And by the way, today we are joined by Jack, who is just being a freaking baby, like the biggest baby on the goddamn planet. He's just desperate for pets. He's begging and making cute little chirpy noises. He's like, Dad, please pet me, I love you. Alright. So, let's get into this. First of all, I know that it's really low-hanging fruit and simply shitty and inappropriate to make fun of somebody's appearance, but man, look at him. What is with these thumbnails? Yes, I have seen this video before. It's actually what inspired me to make my YouTube channel in the first place, because this video has scared the shit out of so many trans guys. I've run into so many trans guys online, especially on Reddit, who are afraid to start testosterone because of this video. That's really fucked up. That's really not okay. And so hopefully we're going to be able to address a lot of the misinformation that's in this video. Man, look at him. Doesn't he look like he shaved his eyebrows and eyelashes off just for this thumbnail? Fucking spooky. And this, what is this? He put eyeliner on and made this face 6 inches away from the camera and put the word smegma, trans smegma, in the thumbnail. Very eye-catching. But I mean, like, if you get no fucking views, then I guess you have to pull shit like this. So before we jumped into this video, I wanted to give a little bit of appreciation for Buck's ingenuity when it comes to this thumbnail in particular for this video that we're about to watch, which is the thing that I like about this thumbnail the most, is that it's not plagiarized. He thought of it all on his own. He didn't take it from anybody else. And you can tell because the color of the video thumbnail that the one lady made a year before him, it's a slightly different color. That's how you know. It is also about vaginal atrophy, and it was made before his video, and it got several views. So he was probably thinking like, hey, maybe I can make a video about this too and get a bunch of views. I just gotta make it look like the same thumbnail for some reason. I don't know. Buck, what are you doing? This is so embarrassing. And like how morally bankrupt do you get? How little self-respect do you have? Why do you do things like this? Okay, so I want to say that none of Buck's other thumbnails
smegma
look like that. It's only this one. And if you look at this, what is her name? Christy MD. If you look at her YouTube channel, she has several thumbnails that use this format. Buck, you can't do shit like this. Maybe he's not hurting anybody by stealing thumbnail designs. But like, have a little self-respect, dude. Just a little. Okay, here we go. By the way, obvious trigger warning for anatomical language if you're not in a good headspace to hear about this stuff. So here we go.
Their Trampa 101. It's going to be fun because we're going to talk about all kinds of cool stuff that Trampa had to deal with, and hopefully you won't have to deal with. So this segment, we're going to talk about something that's a little bit more serious and a little bit more, I wouldn't say more important, but very important. And that is atrophy. It's something that we very, very rarely have spoken about, but now we are, because we've brought it to the attention of our community as well as to the doctors. So it's something that we're definitely talking about. But what I do notice is that a lot of you youngsters don't even know what atrophy is. And of course you don't. If no one's talking about it, how do you know about it? I'm going to use my story of atrophy in order to explain to you what atrophy is, why it is important that we discuss it, and how we can move forward in educating our medical system and educating ourselves. Because if you don't educate yourself and you don't know your own body, how are you going to have a healthy transition?
So far, totally agree with everything that he said. I want to say that I do appreciate and respect somebody with a really large platform, a trans person with a large platform, coming forward and giving their story, telling a bunch of people what happened to him. Because, like he said, there's not a lot of information out there about atrophy, and a lot of doctors are not trained to diagnose or treat atrophy in transmasculine people. However, as we'll see as this goes on, he becomes, unfortunately, more and more irresponsible with his messaging. Particularly, I wish that Buck was more aware and more tactful when it comes to navigating a topic like this, because transphobes, like I said, eat this shit up. There is a book called Irreversible Damage, one of the really popular transphobic books that are out right now. Any kind of like health problems that can occur with transition, they love that shit. They absolutely love that shit. Transphobes do. And there is a way to talk about this stuff without drawing a lot of sensational negative attention to it.
It's real, kids. Even the parts of the body that you don't want to touch, don't want to look at, don't want to think about. That happens to be your vagina. I know, because I have a vagina too, and I'm a guy too, and I used to not particularly care for my vagina. Now I do, as you know. But there was times when I did not like my vagina, and I would not touch it, I would not look at it, I would not even go to the gynecologist. I know some of you kids out there are not going to the gynecologist. We need to change that. We need to make it more accessible, we need to make it more of a friendly thing, and not something that you're terrified to go to.
Totally
agree,
my dude.
What I'm going to talk about is atrophy, and how I got it, and how I fixed it, and why you should not have it too.
You guys absolutely do need to be going to the gynecologist. I'm a trans guy who has dysphoria. My bottom dysphoria is not super severe, luckily. I'm very grateful. But I do have a history of repeated sexual assault. I'm diagnosed with PTSD as a result. I'm actually disabled by PTSD. And I still go to the dermatologist. And the best thing you can do... Did I say dermatologist? I'm sorry, gynecologist. I do go to the dermatologist, so as you can tell from my beautiful glowing complexion, when you go to a gynecologist, okay, advice, real talk, you, first of all, you find the right gynecologist by reaching out to your local LGBT community. You can talk to other trans people who live in your area and say, hey, who's the right gynecologist to go to? Like, who is actually competent in treating trans patients? Who knows how to speak with me and treat me respectfully? That's step number one. Before you set up the appointment, you find the right doctor. Second thing you do is whenever you are in there, you say, hey, I got a lot of dysphoria, or hey, like, I'm uncomfortable with this, or in my case, I say, hey, I have PTSD from sexual assault. Like, before they even say, hey, it's time to take your pants off, I let them know. Even when I go to the dentist, I say, I have a history of sexual assault, so, like, this might be a little bit difficult for me. And they always say, oh, okay, thanks for letting me know. I'll do my best to make this as, like, quick and painless as possible. And they're able to be more understanding and more patient. And, you know, like, a lot of the time, like, doctors, they're just doing their jobs, and they can get into a routine where they aren't particularly gentle or careful with every single patient. But if you let them know that you have particular needs, then most people will do their best to accommodate them. So that is my advice for going to these uncomfortable doctor's visits. Really important that you go.
So I started taking testosterone about 23 years ago, and back then we didn't talk about the bad effects of testosterone on a biological female body. So with that comes complications. Complications, we still don't know what they are, but there are many complications that can come with this. We don't know all of them, but one of them we do know now because of me is atrophy. What happens when you stick testosterone into a body?
I want to give you guys a warning real quick. He uses very cis-normative language. A lot of people aren't comfortable with using, like, female body in place of AFAB. AFAB is a much more accurate and comfortable way to describe a person who has a female body. It's assigned female at birth. One of the reasons why it's more accurate is because both like potentially surgical transition and hormonal transition change your body so much that it's literally not even accurate to say that I have a female body. It's more accurate to just say specifically, like, he's got this much testosterone. You know, like, my testosterone ranges are about average for a cis male. And I do not have titties. I do have vagine. It's just really depends on the situation. So yeah, like, when in doubt, use AMAB or AFAB, assigned female at birth, assigned male at birth. This is for you cis people out there. Don't say female bodied, okay? That's kind of fucked up shit to say. I'm a guy, so I got a male body. Makes sense? Got it? Okay, good.
That doesn't have testosterone, or a very small amount. A transsexual man or a transgender man. What happens is when you stick the testosterone in, you start to get male characteristics, you start to look like a man, you start to have hair, you get all muscles, you get all of these things. But what happens is that it starts to also eliminate the estrogen in your body. And as we know, or you don't know, male and female both have estrogen and testosterone. Men have a higher rate of testosterone, women have a higher rate of estrogen. That's just basic biology. Now, please don't get upset at me for using gender terms or things. You don't have to relate to any of that. This is only specifically a story so that you can understand what I'm talking about. Please do not get yourself upset about male, female, gender, binary. I am binary. I live my life as binary, so I will use these terms. But in no way, shape, or form do I want to alienate you. So please put that aside right now, because the conversation is more important than that.
It is really frustrating to hear him say that, because a lot of the time I feel like Buck is coming from a genuine place of concern where he does want to try to help transmasculine people avoid these medical complications. And that's really good. I'm really happy that he wants to do that. I want to do that too. But you can't just say, hey, don't let this alienate you. I'm going to continue to use language that makes you uncomfortable. I'm going to say that you have a female body. Like, get over it. Don't let it alienate you. Now let's continue. It's like, I just want to let you know, Buck, that that's not how it works. If you don't want to alienate your audience, you need to accommodate your audience, okay? If you're trying to reach out to people who are assigned female at birth, who are on testosterone, who might be non-binary. They might not be men, okay? And they probably definitely do not want you to call them female-bodied. If you don't want to alienate people, modify your language. It's not that hard.
So when you add testosterone into a female-bodied person, you are lowering the estrogen and highering the testosterone. Male characteristics happen, things like muscles, hair, body starts to change, odor starts to change. And what happens is your vagina functions because of estrogen. A vagina is a functioning machine. It's sort of like a self-cleaning dishwasher. It's a self-cleaning oven. It's very much its own space, but it needs estrogen in order to function. So what happened to me was, okay, so I wanted to go ahead and butt in here and say that he's totally correct about how atrophy happens. It is caused not by the presence of testosterone, but the lack of estrogen in the body. This lack of estrogen that causes atrophy is referred to officially as genitourinary syndrome of menopause, which I always try to mention because those are the search terms you should use if you want to find academic papers, like medical literature about this condition. What happens essentially is that whenever an AFAB person starts getting testosterone replacement therapy, there's an axis. It's like the pituitary gonadal. Let's look it up. Let's be sciencey today, okay? HPA axis. I'm sorry, but the correct answer was HPG axis. G for gonads, not A for adrenal gland. You half-wit, you dolt, you buffoon. Basically what happens whenever you start testosterone is that these glands say, oh, sex hormone, testosterone, yeah, we got lots of that. We got a whole bunch of sex hormone. We don't really need to make any sex hormone anymore. And it basically says, hey, ovaries, you can take a break. We're good. We're good on the sex hormone. So whenever you start testosterone and you stop menstruating, it's because of the suppression of the ovaries. The ovaries are no longer active, and it essentially causes an early menopause, which is potentially reversible depending on how long you stay on testosterone and I guess potentially a myriad of factors that we probably don't know yet. But a lot of people who are on testosterone can stop testosterone after a couple of years and start having periods again, almost like nothing happened. It can be potentially just like a pause button. And by the way, of course, really important to know that you can still get pregnant when you're on testosterone. If you're on testosterone and you're not having periods, that doesn't mean that you can't get pregnant. And a lot of people assume that they 100% are safe from pregnancy, and that is not the case. Really important to know that. And in my opinion, it's really important to clarify that it's not the presence of testosterone that's causing problems, because a lot of people act like, you're shooting up testosterone, it's gonna cause all these health problems, you're gonna get cancer. Absolutely not the case. And in fact, the health issue that trans men go through
is, like I said, medically analogous to the genitourinary syndrome of menopause that cis women go through whenever they experience menopause around age 51 on average. And that's really important because of that stigmatization and that fear-mongering that is so prevalent when it comes to discussions about trans people and our bodies. If you're gonna say that atrophy, that the FTM atrophy, vaginal atrophy, is so dangerous and disgusting and life-threatening, all this shit, you have to say the same thing about old women. You have to say the same thing about your goddamn grandma, which is really inappropriate and cruel. And I know that people do not talk about their grandma's bodies like this. It's really strange behavior. Okay, I'm talking way too much. Let's see what Buck's got to say.
Many years of taking testosterone, all of a sudden, after having sex, I would get horrible cramps. And these
go back.
many years of taking testosterone, all of a sudden, after having sex, I would get horrible cramps. And these cramps were debilitating for me. So to where I couldn't move for an hour or so afterward. And it felt exactly like period cramps. I went to many gynecologists. Some of them wouldn't work on me. Some of them didn't feel comfortable. Some of them did and just pushed it off and said, gave me a pap smear, said, you're fine. We don't really know what's wrong. It'll go away. All the things they do when they don't know anything is wrong. Then one day I fell on the floor. I became septic. I almost died. I had 108-degree temperature. They didn't know what it was. I lived in Mexico at the time. Rushed to the emergency. Had to say, hold up, wait a minute. I'm a man with a vagina. They were like...
I wanted to say that I really empathize with this happening to him, and this is the reason why a lot of trans people avoid going to the doctor, especially trans men avoiding going to the gynecologist. A lot of the time, there's something called trans broken arm syndrome, okay? And that is whenever we go to the doctor's office and we say, hey, I'm having heart palpitations, my chest hurts, or whatever, and they say, oh, it's probably because you're on testosterone and you should quit the testosterone. They don't tend to investigate as thoroughly as they would for other people. It's very similar to what fat people go through, which a lot of people refer to as fat phobia. A lot of the time, fat people go to the doctor, they say that they have some kind of symptoms, and the doctor says, you need to lose weight. I'll see you in a couple months. And a lot of the time, people end up dying or getting like progressive disabilities, conditions that aren't treated because the doctor failed to properly diagnose them. It's incredibly frustrating, and this is also an experience that a lot of people of color, especially women of color, experience. There's a very good chance that a doctor is going to overlook something that is wrong with you because of a myriad of misconceptions of women being more whiny, fat people definitely just need to lose weight. It's important to realize that doctors are fallible. I don't want to sound like a hack. I don't want to give you the impression that you shouldn't trust any doctors, but trans people are minorities. We are also medical minorities, and because of that, a lot of doctors are not trained to know how to take care of our bodies. Like Buck said here, he was having these cramps. I'm sure he was not having periods. At least he did not mention any spotting, bleeding, or periods occurring while he was on testosterone, but he was having menstrual cramps. And this is most likely a sign of some kind of endometrial atrophy. It is not just the vagina that experiences atrophy from a lack of estrogen, but the urinary tract, the bladder, the cervix, and the uterus are very dense with estrogen receptors, and if there is not estrogen available to bind to those receptors, then cell regeneration tends to slow down, pH level raises, so that it is no longer acidic in the vagina, especially where the first line of defense against infection is the acidity, as well as the microbiome, the bacteria in that area, the good bacteria that are present. They help prevent infection, but if the pH level rises and these parts become alkaline, it messes with the population of bacteria that are supposed to be there to help keep your body protected from infection, as well as that lack of cell regeneration and increased risk of dryness, injury, and tearing. Untreated atrophy raises a person's risk of various kinds of infection massively. For some people, it's not a problem. Some people notice almost no negative effects for several years. For me, though, I was only 12 months on testosterone whenever I started getting chronic UTIs. Like I said, it's not just the vagina, it is also the urinary tract and the bladder. And my urinary tract and bladder had a real bad fucking time. If you start a topical estrogen, first thing I want to say is it is very unlikely to negatively impact your transition. It is very unlikely to feminize your body in any way because topical estrogens have extremely low systemic absorption. That means it's only really going to be absorbed by those body parts, the downstairs parts that need them. It's not really going to be in your blood. It's not going to be circulating in the rest of your body. Second thing, besides the low absorption, is if you already went through an estrogen dominant puberty, then putting more estrogen in your body is not going to further feminize your body. Like, for example, I had top surgery. Growing boobies is a one-time deal, okay? You don't get to grow boobies 2 times. You can't cut them off, start estrogen, and then grow more boobies. That's not how it works. You cut off the boobies, then they're gone forever. And when it comes to hip development as well, and fat distribution, things like that, you already grew the hips. They're already there. Getting a little bit extra estrogen in your body isn't going to make them any bigger. However, if you're a person who started hormone blockers whenever you were very young and you didn't have breast development and you didn't have hip development or fat distribution, that's typical of 𝗵𝗲 puberty, then there's like a small potential for concern. I think that you would definitely want to talk to an experienced endocrinologist who's educated on, like, a trans competent endocrinologist about that, because I wouldn't be able to tell you for sure if it would be a problem or not, but I would err on the side of it's probably okay, especially if you're on testosterone, especially if your ovaries are suppressed, or especially if you have removed your ovaries. Yeah. Anyways, I'm not a doctor. Let's keep watching the video.
We don't care about that. What's wrong? They dug around. They found out that I atrophied, which then caused the walls of my vagina to harden. It caused my cervix and my uterus to fuse together because there was no estrogen in my vagina. Vaginas need estrogen to function. All that time when the doctors were giving me a pap smear, they had no idea to think about atrophy. Why they didn't, I don't know. I told them I was a transsexual man. I told them I was taking testosterone. They didn't say anything about that. So I had to have 3 months full of hardcore antibiotics because my infection was so bad. My uterus had turned into a petri dish. It was closed off. It was not functioning. What I have here is a fake little model vagina. It's for medical use. I think we used it on one of the other videos. What happens when they give you a pap smear is this. They go into your vagina and swab the inside. See my little...
You know, I don't actually think that's accurate. I think whenever you get a pap smear, don't they swab the cervix? And that's what the speculum is for? Let's look it up. Pap smear. A procedure in which a small brush or spatula is used to remove cells from the cervix so they can be checked under a microscope for cervical cancer or cell changes that may lead to cervical cancer. So the reason why this is important, if Buck actually got a proper pap smear from a doctor who knew what they were doing. No, they did not just swab the inside of the vagina. They would have used a speculum, got access to the cervix, and swabbed the inside of the cervix. And the reason why this is important is because Buck is claiming that at least one doctor who gave him a pap smear did not notice or did not diagnose what he refers to as his uterus and cervix being fused together. So we want to get to the bottom of this. We want to know what happened to Buck. How did he get this severe, life-threatening infection in his uterus? Because that's really spooky and really dangerous. A lot of trans guys have seen this video and they have been scared out of starting testosterone that they want and need to alleviate their dysphoria because of this video. So first thing we need to do is figure out what the fuck he's talking about when he says that his cervix fused to his uterus. Those were his words. This is not like a medical terminology that I can find anywhere. It's a really unusual way to describe the situation, and what I think he is actually describing is cervical stenosis, which basically just means that the cervix is inflamed or it becomes closed off for some reason. A lot of the time it is inflammation that causes the cervix to close, and because the cervix was closed, there wasn't a way for the uterus to empty out anything that was inside of it. What causes cervical stenosis, which we can be reasonably sure is what he is describing in this situation, especially because if we read about if we read about infections in the uterus, where the uterus fills up with pus and where a person can have sepsis and fever and this life-threatening situation, this diagnosis that he doesn't mention in the video is most likely a condition called 𝗵𝘂𝗰𝗄, which is actually, I will make you happy by saying this, actually extremely rare in humans. I searched for the word 𝗵𝘂𝗰𝗄, and we see pictures of dogs because it is common in unspayed dogs and cats who haven't had a litter. Oh, let's see. Patient.info. 𝗵𝘂𝗰𝗄 is a rare disorder in humans with a reported incidence of 0.01 to 0.5% of gynecological patients. It is actually exceedingly rare in humans. And so, like, I think it is a genuine question, though. Like, even though it's rare in humans, is there a possibility that being on testosterone could somehow make it more likely for a human to develop 𝗵𝘂𝗰𝗄? Is that a thing that could happen? This is speculation. This is my hypothesis, which is Buck mentioned that he had started testosterone 23 years prior to this event, if I'm understanding correctly. And so if you think about it this way, most cis women, when they experience atrophy, it doesn't start until they're about 50 years old. And so whenever atrophy, this genitourinary syndrome of menopause, it's a progressive condition. So it gets worse over time if it's not treated. So if you start menopause, if you start developing this condition at age 50, you know, maybe you're only going to live for another 20 or 30 years, and you might not develop very severe issues in that amount of time. However, a lot of trans guys start transition when they're teenagers or start in their 20s or 30s. Even if you start like at age 30, that's still 20 extra years for this condition to progress. I haven't heard any doctors talk about this. And like I said, I have no medical training whatsoever. I'm not a doctor. I've just read a lot of goddamn papers about this. And it's my guess. It is my guess that there is a potential that atrophy could potentially be more severe in transmasculine people because this menopause starts significantly earlier in life. I would like to mention, by the way, that 𝗵𝘃𝗃 is significantly more common in postmenopausal cis women than it is in premenopausal cis women. So now we're going to answer the big question, which is, did testosterone cause this to happen to Buck Angel? Did it cause the 𝗵𝘃𝗃 and the medical emergency that he had? My answer, based on my limited gynecological knowledge, is probably yes, but it's not guaranteed that this was the only factor. And most important part is that just because Buck had this happen, that it does not predict this outcome in other transmasculine people on testosterone. That's the most important takeaway. Other thing I want to mention is that there are multiple causes of cervical stenosis. First one at the top of the list on this website is menopause. Menopause because the tissues in the cervix thin, atrophy. And so, yes, a lack of estrogen absolutely can contribute to cervical stenosis developing, but it's not guaranteed. Like I said, it's very uncommon in humans. It's very uncommon for humans to experience 𝗵𝘃𝗃. Cancer of the cervix, cervical cancer, or endometrial cancer are the next reasons for 𝗵𝘃𝗃. And so I want to say the most common cause of cervical cancer is actually HPV, okay? Cancer.gov, okay? You're hearing it from cancer.gov, not from me. It says virtually all cervical cancers are caused by HPV. Routine screening can prevent most cervical cancers by allowing health providers to find and remove precancerous cells before they develop into cancer. Okay? Really heckin' important to know, because guess what? Did you know that there's a vaccine to help prevent HPV? What? HPV vaccine. Okay? So here's the part where I tell you that we can prevent this from happening to young trans men, or young transmasculine people, or old transmasculine people, or hey, just old anybody. If you qualify for the HPV, like if it's appropriate for you, I totally recommend it. HPV vaccine, I think, is just referred to as Gardasil. I've had it's a multi-round vaccine that you take over several months, and I have had 2 out of my 3 injections. I have my 3rd injection coming up in October. Okay, so there's a couple other things that could potentially cause cervical stenosis, the closing off of the cervix. Procedures that destroy or remove the lining of the uterus. Endometrial ablation, that's really interesting. Not a very common procedure, but it is potentially one that some trans men might benefit from. Endometrial ablation is really neat stuff. I actually talked about it in a previous video. Surgery that involves the cervix, for example, done to treat precancerous changes of the cervix. Yeah, we actually mentioned that over here. And also radiation therapy to treat cervical cancer or endometrial cancer can cause cervical stenosis. Doctors confirm the diagnosis by trying to pass a probe through the cervix into the uterus. If a doctor did not try that diagnostic method with him, then I guess that it just kind of went under the radar because of that. I've had multiple pap smears in my life, and I've never had a doctor routinely attempt to do this probing thing. They've always just used a speculum to open up the cervix and then take some samples out. I don't know if during a regular pap smear, if a doctor would or could notice stenosis. I have no idea. All right, so main takeaway of this video so far, Buck Angel had 𝗵𝘃𝗃. That would most likely have been his diagnosis, this infection of the uterus, which is generally caused by, and by his own description, most likely caused by cervical stenosis, which was very likely caused by atrophy, or potentially, maybe, I don't know, I think Buck probably would have mentioned it. I hope he would have mentioned it if it was actually caused by cervical cancer and like HPV or something like that. But that actually is not something that Buck has disclosed, so I think it is reasonable to assume that Buck's atrophy is what caused this emergency situation with the infected uterus with pyometra.
Finger, they're swabbing the inside, but they don't go to the uterus. And the uterus, somewhere here, my hand's moving all over the place, is connected to the cervix. So what happened is it cut it off. It literally cut my uterus off so that it could not function and self-clean out here. I'm looking at everything backwards when I'm doing it. So it cut it off. So when they do a pap smear, they're only doing it on the inside of the cervix. What I needed to have was a ultrasound, because the ultrasound will look in the uterus, and the ultrasound will see whether or not things are happening that you cannot see when you are only doing a pap smear.
He is correct about this. Vaginal swabs and cervix swabs are not appropriate for diagnosing pyometra. Apparently, 50% of vaginal swabs to check for bacterial infection, they aren't going to detect a bacterial infection that is in a closed-off uterus. Yeah, kind of makes sense. And with pyometra, the uterus becomes very enlarged, and so that shows up on an ultrasound. Ultrasound is the way to go.
This is a very important part of the conversation. For some reason, our gynecologists don't understand what's happening when you are taking testosterone. They are not understanding that your vagina is getting atrophied because of the loss of estrogen. What we need to tell our doctors is it's very similar to a female who goes into menopause. It's exactly the same thing. So if you notice, women who are on menopause, they have dry vagina, they don't feel like having sex, and in a sense can atrophy as well. I do not know the amount of women that atrophy within the cisgender world, but I think that's something we should look into.
How many menopausal cis women experience atrophy, I wonder? We should look into that, says the silly man on the screen. Oh look, it's a study, and it said that it's 40 to 60% of them experience or reported symptoms of atrophy. Yeah, so that's your answer, Buck. It just took a little bit of Googling. Just a little bit. Sorry to be an asshole. I know that most Americans are scientifically illiterate, which included me a couple of years ago. And honestly, I still consider myself scientifically illiterate because I don't have any formal training. But if you ever want to look at a study and it's behind a paywall, there's this really cool thing called Sci-Hub, and I highly recommend you search for Sci-Hub next time you want to look at a study. Yeah.
It is something that has already been happening, yet for some reason the doctors did not apply that to trans men. So when you were given your testosterone, did your doctor say to you, you might have atrophy from this, it's best if you check in with your gynecologist? Nope.
My doctor didn't tell me that.
I don't know if yours did. Probably not.
And that's a problem.
I created a lubrication called 𝗕𝘂𝗃. I didn't create it to make a shit ton of money off you. I created it to make conversation within.
This is a part of the video where I get really fucking mad. Holy shit. He has his most popular video on YouTube, okay? 166,000 views. And he pushes a lube, okay? This is the opposite of tact. This is hack shit. This is not appropriate. This makes me so angry because the implication here is that Buck Angel's lubricant in some way can be used to treat atrophy, which is absolutely not the case. There are some lubricants, and especially like vaginal moisturizers, that can alleviate some of the symptoms of atrophy, but they don't treat atrophy. This is fucking inappropriate. This is egregious. Buck's sitting in front of the camera and advertising his lube in a video that has scared a lot of trans men out of starting testosterone. Advertising his lube during it. I can't explain to you exactly how inappropriate and irresponsible and upsetting it is for him to do this. For him to get up here like a fucking snake oil salesman to scare the shit out of his audience with this graphic, terrifying story of a life-threatening medical condition, and then saying, hey, by the way, here's my lube.
I'm broke, but this stuff is good. It works. I need a healthy young man like you.
I'm not doing this to get a bunch of money. I'm doing it to start a conversation. I'm trying to start a conversation. What do you mean? You don't have to fucking sell anything to start a conversation, dude. What do you think, like, somebody's gonna have their lube displayed on their mantelpiece and another trans guy is gonna walk in and be like, ah, yes, vaginal atrophy. I too have experienced this. It's a good thing that your lube is here so that we are allowed to talk. I don't understand. This is embarrassing. All right, let's hear his pitch.
The medical world around vaginal healthcare, kids. Vaginal healthcare. This gets into gynecological offices, and all around we can start to talk about the lubrication within your vagina. When you are not having lubrication, why? We need to discuss this because it is something that can actually kill you. I almost died from it because of the infection. That's why I'm so serious about this. Like, can you see how serious I am? The conversation needs to be started. We need to talk about this on a bigger level. We need to educate our medical world. We need to let them know about this particular situation because it is horrible. Now, I know what you're going to ask me. Well, 𝘵𝗺𝗃, do I need to get a hysterectomy? That is something I cannot answer. I am not a doctor.
Oh,
but what I will tell you is this. I used to say, nah, you don't need a hysterectomy. Fuck. If I would have got a hysterectomy earlier, I never would have had these problems. So yes, if you are planning on long-term use of testosterone, I highly suggest you get to the gynecologist. I highly suggest you discuss with your gynecologist when is the perfect time for you to get a hysterectomy. This is still very new, kids. We don't even know.
Okay, so it's really, really frustrating, the like disingenuous bait and switch that he does, where he's like, you know, I'm not a doctor. You're gonna ask me, like, do I need a hysterectomy? I'm not a doctor. I can't decide that for you. I don't know what's right for your body. But actually, yes, you should get a hysterectomy. I absolutely recommend it to anyone who is going to be on testosterone long term, because we're fucking guinea pigs, kids. We don't know what's happening. Okay, like, I get it. I get the fear. I understand. I don't like it either. I wish that the mysteries of every human body has been totally solved, but guess what? That's not even the case for cis people, okay? Cis people feel like fucking guinea pigs sometimes too. And yeah, unfortunately, it is more so the case with trans people. But guess what? Doctors, people who know more shit than Buck Angel do, have said on record multiple times that no, you do not have to get a hysterectomy to be on testosterone, okay? That's really, really important. Besides seeing like so many trans guys who've been scared out of even starting testosterone, which they say, I really need this for my dysphoria, and then they're too scared to start it. I've also seen trans guys who are like, okay, I'm gonna start it, but like, when do I need the hysterectomy though? When do I have to get the definitely required, definitely medically necessary hysterectomy? It's not fucking medically necessary. This is not something that is even close to guaranteed to happen to AFABs who are on testosterone. It's fucking ridiculous that he would scare so many people into thinking that this is something that's going to happen to them.
Pyometra is a rare disorder in humans with a reported incidence of 0.01 to 0.5% of gynecological patients.
Something else that I wanted to show you guys is that 𝘆𝑆 made a website. Very, very helpful, 𝘆𝑆. Just worried about trans people's health. It's called ftmhealth.com. And I'm really salty because, you know what, that's a nice URL. Somebody else could have used that address for a website that wasn't stupid. But here is 𝘆𝑆's stupid fucking website. He mentions it in this video, I think, in a couple of minutes. And he says, like, hey, keep checking the website. We're still adding more stuff to it. It's been the same fucking website for at least 6 months. I have been on this website before. So here's a PDF on this website that he recommends trans masculine people take to their doctors. First of all, it's riddled with grammatical errors, which is very silly. Should have gotten somebody to proofread this. A little strange to read. So you're supposed to print this out, take it to your doctor, and it says, "Dear doctor/medical professional, FTM Health have created this leaflet to help with my transgender healthcare. Many trans men have been experiencing pain and discharge. We have put together this leaflet to help you with our specialized needs. Please know this it to help us all move forward with trans health. These are things we have experienced and found a very big commonality with us all. This is why we must have hysterectomies if we are to continue using testosterone supplements." First of all, testosterone supplements, they're supplements. I thought I was getting prescription, not like supplements. You can just get that shit over the counter. Had no idea. You can't get testosterone's not a supplement. You know, and I can't help but have this really mixed reaction of frustration. Like, you know, on one hand, I'm like, wow, thanks for bringing attention to this issue, Buck. Really, really happy to see you using your platform responsibly. Oh, what are you doing with that? What, you're trying to sell lube? You're giving an inaccurate depiction of the story? You couldn't have, gotten your paperwork from the doctor. You couldn't have asked a gynecologist to come on to your channel with you, do a little Skype call or something. You know, like this checklist, like, hey, talk to your doctor if you've had any of this stuff. Yeah, that's good. That's important. Here's some questions that you might want to ask your doctor, like, hey, What's atrophy? There's vaginal atrophy and endometrial atrophy. What's the difference? What's going on there? Hey, should I be having cramps on testosterone? Do I need a hysterectomy?
No.
Yeah, good stuff. Good stuff, Buck. I'm glad you did that. But guess what? You can't fucking tell people that a hysterectomy is right for them, guaranteed, because it's fucking not right for a lot of people. Not every trans man wants bottom surgery. I don't want bottom surgery. Surgery can be expensive. Surgery is not without risk. Some trans men want to be seahorse dads. They want to experience pregnancy even though they're dudes. Even if they might have dysphoria, they just really want to be biological dads, and that's the way that they want to go about it. We do not have to have hysterectomies. Something that I actually feel extremely insecure about. One of the reasons why I don't make videos very often is because I do not have a bachelor's degree. I do not have medical training, like formal medical training of any kind. Everything that I tell you guys on this channel, it's either from firsthand personal experience, things that I have gone through while I've been on testosterone, while I've been transitioning, or it's been stuff that I have read in medical literature with my eyeballs, okay? I'm not a fucking doctor, okay? Like, I don't even have a bachelor's degree. And so I do not feel qualified a lot of the time to even talk about this stuff at all. But Buck feels perfectly qualified. He feels like an authority to the extent that he is comfortable making a PDF like this and telling people to take this to their doctors. How many parents do you think have refused to let their child start testosterone because they were convinced that it would doom their child to severe medical consequences down the road, or force their kid to have to get a hysterectomy. How many parents do you think have been influenced by this? How many, like, goddamn. I know that I've been bashing on 𝘆𝐴ngel a lot in this video, which he totally deserves. And unfortunately, he has a very thin skin, which you can find out very easily by watching any video interviews where somebody gently criticizes him and brings up something that they feel like he's done wrong. He's not willing to entertain the idea that he's done some fucked up stuff, and like, I would hope that if Buck ever saw this video, that he would consider retracting his statements and removing this from his website especially, and maybe just putting it in the description or putting it in a comment on that video that no, actually, it's incorrect. You do not have to get a hysterectomy in order to stay on testosterone. Being on testosterone does not increase your risk of endometrial cancer nor ovarian cancer. It somewhat increases your risk of cervical stenosis, which could potentially lead to 𝗵𝘃𝗰𝗂𝗋, like Buck experienced. It could happen, but the risk is probably not much greater than it is for cisgender women who have had hysterectomies where the ovaries were removed. Removing the ovaries, of course, results in not enough estrogen, which results in atrophy, the same atrophy that Buck had, that potentially caused the situation. It is just fucking mind-blowing to me that I have this, like, imposter syndrome where I feel like I shouldn't be able to talk about this. I'm gonna get in trouble. I'm doing something wrong. I'm gonna mislead someone. They're gonna misdiagnose atrophy when they had something else going on, and then that's not gonna get treated, and then it's gonna be all my fault that something bad happens to them. That's what's going through my head, okay, whenever I talk about this stuff. And Buck is like, scare people out of starting testosterone or scare them into getting a hysterectomy. Yeah, like, it's cool as long as I get clicks and sell some lube. I know that he thinks that he's helping, but this isn't helping. Let's see if he's got anything else to say.
Some people are having these cramps at 4 months. Some people aren't having them until a year. Some people aren't having them until 5. Some people aren't having them at all. The bottom line is this. Are you taking care of your vagina? Are you understanding that every day the testosterone is removing the estrogen from your vagina? Are you understanding that you are in control of your own health care? If you have questions about atrophy or questions about how to move forward, I also created a site called ftmhealth.com with the community. So we are adding all kinds of new stuff on there. There'll be amazing information for you to use to get to your gynecologist. I know how hard it is. Don't even think I don't. 100% I know how hard it is for you to go to the gynecologist. Do you care about you? If you are transitioning, you do. That means you have to do some of the things you fear and some of the things you have not yet done. And that's the gynecologist, kids. So reach out to me, ask me questions, whatever I can do to help you. Give me more ideas about what else you want, Grandpa.
Don't reach out to 𝘆𝐴ngel. He doesn't know what the fuck he's talking about. Oh, this is juicy. OMG. Buck responded to my comment. Alright, so this is my old YouTube. Y'all aren't allowed to look at this channel. A lot of this is good information, and I appreciate you using your platform to educate, but you should not be pressuring folks to get unnecessary medical procedures. The idea that trans men need hysterectomies to maintain their health is outdated and not evidence-based. True, past me of 9 months ago. Man, I've been mad about this for at least 9 months. That's a long time to be mad. I'm a tiny man carrying a lot of rage. There are other ways of treating vaginal atrophy without resorting to a histo. Namely, estrogen inserted directly into the vagina prevents and treats atrophy. However, this is not without risk. Unopposed estrogen increases the risk for endometrial cancer. After 5 years of use, your risk is double that of a person who does not use an unopposed estrogen cream, and the risk increases the longer you continue to use it. But this cancer risk is eliminated if you introduce a progestin to oppose estrogen. Estrogen and progestin inserted into the vagina will not cause other parts of the body to feminize. However, estrogen plus progestin hormone therapy increases the risk of breast cancer. Breast cancer risk is very low for post-top surgery folks like me. You got no boobies, you got very, very little breast tissue, you're probably not going to get breast cancer is what that means. Do your research and talk to a gynecologist. I'm FTM and I've been on T for a little over a year. I started NuvaRing recently to treat/prevent atrophy. A lubrication will not treat atrophy. Alright, so Buck Angel said, and this is, I'm getting passive aggressive vibe already. Thank you, but how did I pressure? I used my own actually story for people to hear so they can make an informed choice. So thank you for your opinion, as that's all it is. Mine is actually fact-based. Get a little heart in here. Jesus fucking Christ, dude. Like I said, he's really fragile. He's very fragile, and he's not interested in learning. He's not interested in the medical science behind his experience. And he's also not interested, like, thank you, but how did I pressure? You made a fucking website, dude. You made a fucking PDF that you tell people to print off and take to their doctor that says that they have to get a hysterectomy if they're on testosterone. Are you fucking kidding me? Thank you, but how did I pressure? Jesus fucking Christ, I hate this guy. I don't know, if we're gonna be true scums here today, I'm gonna say Buck Angel is too passive aggressive to be a guy. Like, that is some lady behavior. That's some feminine, that is some low T shit, dude. You gotta get your levels checked. I don't know what to tell you. Maybe you should engage in a free marketplace of ideas, like a big strong macho man. I just gotta say, like, okay, you see how, like, Buck's muscles are, like, bulging out of his fucking shirt, like his shirt's gonna explode. He can't be contained. He's too strong. Okay, and you see me with my little I got noodles. I'm like, you know those Betty spaghetti dolls? I used to have Betty spaghettis. That's what my arms are like. But guess what? You know, he'd fucking kill me with his pinky. You know, like he could throw me with a single finger, and I'd hit my head on the brick wall across, you know, like 100 yards away. My teeth would fall out. I'd have brain damage, and I'd die. That's what would happen. But I'm willing to do it. I'm willing to get in a physical confrontation with Buck Angel. Never been in a fight before. No idea what I'm doing. Not trained. I've been angry for 9 months straight. And we gotta do something. Buck, call me up. Get in touch with me. We're gonna get in a fight, okay? Are you ready? Jesus Christ. I wonder if Buck Angel would think I'm a transgender because I don't pass 100% of the time. I'm pretty sure that's the qualification, right? Like, sometimes I wear leggings. I like leggings and I like crop tops and I wear them sometimes. Usually not out of the house because I don't like to get misgendered. But those are lady clothes. So, yeah. I'm not valid. I'm not valid enough to get in a fight with Buck Angel. Buck, I fucking hate you so much.
I'm a binary trans man. That is my experience. I don't have to use inclusive language to non-binary people because I'm binary. So if you're telling me to use inclusive language, then you're excluding me, who is binary. Don't you understand? You're the bigot.